All right, guys, so we're going to talk now about our eighth procedure, which is the vitals and medication or allergy reconciliation. So this procedure is going to highlight what the medical assistant, the MA, or the behavioral health nurse, if and when we have one again, will conduct and how they'll conduct the vitals, the med rec, and the allergy rec. So vitals, as far as telehealth is concerned right now, we don't really have a good way to collect those. Now, they make some really cool tools and stuff that you can use, but ultimately somebody has to be there still with the patient to do it. So instead, in a combination effort with the medical assistant and the PCRs, we'll be informing the patients that are meeting with one of the psychiatrists or the nurse practitioner to take their own vitals at home if they have the access and the knowledge to do it. So weight, temperature, blood pressure, waist circumference, whatever it may be. I have faith that our patients, if we ask them to do this, will actually perform, and some of them may even go and buy the equipment that they need to do it. However, here's the general process. So after the PCR has completed the check-in, the PCR will then notify the MA or the nurse that the patients are ready for vitals and reconciliation. The MA or the nurse will then reach out to the patient to collect the vitals and also to complete the med rec and the allergy rec, and then the MA or the nurse will notify the provider that the patient is ready for their appointment. All that communication can happen via in-person, email, Athena text, or through Doxy at the MA or the nurse's preference. So in general, the med rec is just to occur like this, the patients to have the bottles in front of them and read to the MA or the nurse what they're taking and the prescribing instructions. Same with allergies. The patient will tell them the current allergies and if any new ones have developed, and then the MA or the nurse will then enter them into the EHR as the current policy and procedure dictates. That should be it. So next we're going to talk about the prescription procedures for our prescribing providers.